So I'd now like to bring to the microphone our final speaker, Ms. Christie. I'll hand it over to you, Christine.
Thank you, Vanessa. Hi, everyone, and welcome. As Vanessa said, my name is Christine, and I have been asked along today to share with you my experiences with genetic testing and its effect on our family. I think it's reasonable to say that I have come to an ovarian cancer diagnosis from a slightly different angle to many women, and I like to think that our family's story might be a cautionary tale for other people out there. I feel it shows the value in having the courage to undergo genetic testing if there is any suggestion that you or your family might be at risk of carrying a mutation. It would be very easy to just put it into the too hard basket. But I also think that it highlights the value in understanding the risks associated with your genetic status, and also the value in taking that knowledge, learning more about it, and then making considered choices that sit well with you. To understand why genetic testing has been important for our family, we have to look back over a number of generations at the history of cancer in my father's side of the family. I always knew growing up that Dad's mother had breast cancer, one of his sisters had ovarian cancer, and another of his sisters had breast cancer. My dad was just 13 when his mother died. His sister with ovarian cancer died when I was 8, and his sister with breast cancer died from the effects of treatment when I was in my mid-20s. As an adult, I also learned that my great-grandmother had died of breast cancer too. For some inexplicable reason, and I'll never understand why, I always felt that this family history of cancer was important to me. At times, I think the rest of the family thought I was a little bit preoccupied by it all. And although it was not a topic that was talked about frequently in our family, and it never interfered with my life in any way, it was always there in the back of my mind as something that I needed to be aware of. The women were very much missed in our family, and their deaths from the same disease was always the elephant in the room, so to speak. Everyone just managed to get on with their lives and hope that cancer did not appear again. In the early 1980s, I became a nurse, and that education meant that when the BRCA genes were discovered in the mid-1990s, I sat up and took notice. By that stage, I was married with a couple of young children of my own. In 2001, aged 35, I discovered a small breast lump. My heart sank and the fears of cancer were real. Fortunately, though, after a biopsy, that lump proved to be benign. As a result of that breast lump, though, our family's cancer history came to the attention of my breast surgeon, and with his encouragement, I attended a familial cancer centre to seek advice regarding the possibility of genetic testing based purely on our family history. Before attending the appointment, I had to fill in a family tree for both sides of my family that identified any cancers that family members had had, so that the counsellor could look at it and assess the potential for our family to carry a mutation. I had to ring up relatives, discuss histories, and a number of those relatives I hadn't spoken to for years. And I spoke at length with my parents to be sure that I was presenting information that was accurate. At the appointment, the genetic counsellor did identify our family as high risk for carrying a mutation, but she advised me that genetic testing was not possible, as at that time, testing could only be offered to a family member who actually had cancer. And as I said earlier, all family members had long since died. In 2001, the science of such genetic mutations was still too new. And as the counsellor told me, it would have been like looking for a needle in a haystack. I, along with other members of the family, was advised to undergo high-risk surveillance of my breasts. There was no specific recommendations for ovarian screening, however, beyond the suggestion that risk for ovarian cancer did not rise until mid-40s. Time slid by, along with yearly mammograms and breast ultrasounds and several, again fortunately benign, breast biopsies. And then in late 2013, aged 47, I presented to the same genetic counselling service for some updated advice. Part of my motivation was my daughters. They were growing up and leaving home, and I did not know what to tell them regarding their risks. I wanted some insight so that I could advise them if there was anything that they needed to do. At the appointment, I was told that testing could now be done on our family, and that over the years since my first appointment, a database of known mutations had been built up, and that our genetic structure could be compared to that database to try and identify any abnormalities. I was told, though, that our family did not meet guidelines for funding and we were going to have to pay 100% of the cost to have that testing done. The genetic counsellor also wanted to test my dad first, instead of me, as he was the blood relative closest to the women who had been affected by cancer, and there was a higher chance of finding something in him if something did actually exist. After waiting 3 months for an appointment for Dad, out came my credit card, and in early 2014, my dad was the first in our family to undergo genetic testing. At that time, they tested 4 of Dad's genes to look for a fault. I'm incredibly grateful to my dad for so readily agreeing to do that testing, as ultimately it has made an enormous difference to me and to our family. The results had to be received at a face-to-face appointment with a genetic counsellor, and so my dad asked me if I could get his results for him. Travelling to the city from their rural location was just too difficult. We waited 2 months for Dad's results to come back, and they showed that he had tested positive for a fault on his BRCA1 gene. And that fault did put carriers at increased risk of breast and ovarian cancer. On the same day that I received his results, I underwent my own genetic testing. Now that a fault had been identified, any further genetic tests were fortunately covered by funding. When my results came back 2 months later, I learned that I had inherited that BRCA1 fault from him. My husband was with me when we received the results, and I recall saying to him, well, that's not surprising. Though there was a 50% chance that I had not inherited the fault from Dad, testing positive just reinforced all that I had ever felt, that this was an important issue for me. While waiting over those months for the rather time-consuming process of testing to unfold, I had given a lot of thought to what I would do if my tests came back positive, how I would manage the risk, and how I would move forward with that knowledge. By the time I received my positive results, I was 48, so I immediately arranged an appointment with a specialist gynecologic oncologist to organise surgery to decrease my ovarian cancer risk. My ovaries and associated anatomy had served their purpose well, but I felt that they now represented an unacceptable risk to me. A mere 8 weeks after learning of my BRCA status, I underwent a bilateral salpingo-oophorectomy and hysterectomy. 36 hours after the operation, just when I was expecting to be discharged from hospital, the surgeon came into my room, sat on my hospital bed, and told me that a small tumour had been identified on pathology, that I had cancer, a high-grade serous epithelial ovarian tumour. That conversation is firmly embedded in my memory. I recall a weird sense of disbelief. There I was thinking I had been going to decrease my cancer risk when I actually already had a tumour. I still look back on that day with a strange sense of disconnect, like it was someone else's experience or a movie that I had been watching. As I'm sure many of you can relate to, things moved quickly from that point. Oncology consultations, a PET scan, meetings with oncology nurses, loads and loads of pamphlets to read, many tears, endless questions with no answers, overwhelming fears, and 6 rounds of carboplatin, paclitaxel chemotherapy. But here I am now, approaching 5 years since that surgery, and extremely grateful to be in good health. That genetic test was the one thing, the only thing that enabled me to be fortunate enough to get an early cancer diagnosis. A couple of weeks prior to getting my genetic results back, I had had ovarian screening done, a CA125 and a transvaginal ultrasound, and the results were perfectly normal. I was also completely well with no symptoms whatsoever to suggest that anything was wrong. Having that early diagnosis means that my chances of remaining cancer-free are higher than if the cancer had spread and I had become symptomatic. Of course, no cancer diagnosis is good, as I'm sure everyone can agree. I am grateful that I was curious enough to investigate the family history, and I am grateful that I had the courage to go ahead with genetic testing. And I am also grateful that on hearing of the risks of carrying that mutation, that I decided to act on it. While genetic testing ultimately did not prevent me from getting that cancer diagnosis, it has enabled other family members to undergo testing and become aware of their risks. Hopefully those who have tested positive will now be able to avoid a cancer diagnosis. Knowing about that pesky mutation has given us an opportunity to deal with it, to manage it, and to take some sort of control over our own health. Since completing treatment for the ovarian cancer, I have also undergone prophylactic bilateral mastectomy with reconstruction to decrease my high lifetime risk of breast cancer. Of course, the thought of undergoing genetic testing can be daunting. While the actual process of attending a familial cancer centre, undergoing the genetic counselling session and having the blood test were all really quite straightforward, I'll be the first to admit that I was extremely nervous waiting for my results to come back. I was aware that finding out this information that I had thought had ramifications for others in the family. I'll also be the first to admit that after I found out I did carry the BRCA1 mutation, that I was uncertain, nervous and scared of the surgeries that I had decided I needed to do. Also, I wasn't sure how other members of my family would view my decisions. But I need not have been concerned. Everyone in my family has been very supportive and grateful, I suppose, to finally have some understanding of why so many members of our family had to go through a cancer diagnosis. Since discovering the mutation, all of my siblings, as well as my cousins on Dad's side of the family, both male and female, have undergone testing. 50% of us have inherited the fault and 50% have not. My two daughters, who are now both in their 20s, have also tested. One has inherited the fault from me and one has not. My two female cousins, who have inherited the fault, have undergone risk-reducing surgeries, and thankfully neither have had a cancer diagnosis. My daughter, who has the fault, is currently doing high-risk surveillance. She will make her own decisions with the full support of her family as she needs to. As a young woman, she has plenty to think about, but at least she is moving forward, knowing that she carries a risk, knowing that she needs to be vigilant, and knowing that she has taken some control over her own future, rather than simply waiting for the hands of fate to deal her cards. The only regret that I have throughout this journey is that I let time slip by and that I did not return to the Familial Cancer Centre for that second time earlier. Of course, regrets serve no good purpose whatsoever to anybody, so I do the only thing that I can do, and that is move forward with my life as best I can. I will say though, that the science of genetics is very much an evolving field, and I think it important that we continue to monitor its progress. What might not seem applicable today might well be applicable in the years ahead. We all need to advocate for ourselves and be as informed as we can be for our own health. Through family research, I have identified more distant branches of the family that might carry this mutation, and I now know that the family cancer history was more extensive than I was aware. I have identified 3 of my grandmother's cousins as having died of breast cancer and who quite probably carried the same mutation. I have managed to contact a couple of people in these family branches, and I was very nervous about making contact with them and telling them of the genetic fault. I was a complete stranger to them, and I felt like I was lobbing information into their lives that they might not want. Like tossing a hand grenade, once tossed, there was no taking it back. But I felt that I had a responsibility to bring this awareness to these people. Generally speaking, though, they have been receptive to the information that I have shared. They have been aware of cancer in their families, so it was not a total surprise for them. How they choose to proceed with the knowledge is their decision to make. At this point in time, I haven't been able to locate all branches of the family who might be affected, but I continue to try and find them, and I do this for a couple of reasons. The first is that I think of my aunts, my grandmother and my great-grandmother, as well as my grandmother's cousins. I ask myself what they would wish me to do, and every time I ask the question, I think that they would encourage me to make the most of an opportunity that they never had. Secondly, I would like to think that if one of the other branches of the family knew about this mutation, that they would have tried to contact our branch and let us know. There are 2 quite famous quotes that also keep me moving forward and encouraging others to consider looking at the option of genetic testing if they are concerned about a history of cancer in the family, or if they have a personal history of cancer that might indicate the presence of a mutation. One is a quote used by a number of influential people, including John F. Kennedy, and it says, "It is better to light the candle than curse the darkness." And I think that quote is rather apt. The light of knowledge has the potential to give families options instead of just stumbling along, not being aware of the risks that they carry. The other quote comes from Mary Claire King, who was instrumental in identifying the BRCA genes and recognising their role in cancer development. She said that to identify a woman as a carrier of a genetic fault only after she develops cancer is a failure of cancer prevention. While I did not avoid a cancer diagnosis, there is no doubt that identifying the genetic fault changed the course of cancer for me. I would like to think that other members of our family now have the chance to avoid cancer, and that can only be a good thing. So, in conclusion, I'm sure you can see that I'm quite an advocate for genetic testing. My experiences have clearly shaped my attitude and approach. As a result, I'm keen to encourage anyone who might have such a genetic predisposition for cancers to try and find out, not only for themselves, but for the benefit of their families as well. I'll now hand back to Vanessa.
Thank you very much, Christine, for that, for sharing your journey. What an incredible insight. And you've really highlighted the importance of genetic testing and being proactive with your health. So thank you for being so honest and open. We do have a couple of questions for you. The first one is, what would you have done if your father had been reluctant to undergo genetic testing?
I was really lucky that Dad was very keen to step up and be tested, but I think if he had said that he wasn't willing to travel to the city and get it done, I would have just presented back to the Familial Cancer Centre, and I'm sure that they would have gone ahead and tested me without Dad having been done first.
Yeah. Okay. And the second question, why did you see a gynecological oncologist for your surgery instead of a normal gynecologist for preventative surgery?
Yeah, it's sort of recommended in the BRCA setting or the genetic mutation setting that if you do have a presenting for prophylactic surgery, that one of the specialist surgeons does it, so that he's the best person to observe if there's likely to be an unidentified cancer discovered during the surgery. And he will also send the tissues off for in-depth pathology analysis to try and identify small tumours that he might not see during surgery. So, and that happened in my case. Yep.
Yeah, great. All right, well, thank you so much. We will leave it there because I understand we have gone over in time, so I do apologise. But thanks again, Christine. We really appreciate you giving up your time and, like I said, just sharing your experience and your journey and being so open and honest. Thank you very much.